if I lose my teeth after 20 years of age, will I have a new teeth growing up? So this was a question asked by one of our subscribers for my previous video. So I gave an answer saying that we need to take an X-ray to check that whether we have a tooth inside, whether it's going to come out. But I thought it would be appropriate I make a new video on this and address this. Hello, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Amalapuram since the year 2001. If you have not subscribed to our channel Pearls Dentistry, please do subscribe. We've got a new video coming out every day. Now let's address this question. Will I have a new tooth coming out after if my teeth falls after 20? First, what we need to understand is all humans have got two sets of teeth. The first set of teeth is called milk teeth or primary teeth, which are 20 in number, which typically grows when you are 6 months old up to 3 years old. These milk teeth are the first set of teeth, so they are called primary teeth. And the second set of teeth are called permanent teeth, which typically starts forming when you are 6 years old and keeps growing. Multiple permanent teeth keeps coming and will last through our adult life. So the milk teeth starts shaking and falling when we are about 6 years old. Permanent teeth starts erecting. By about 12 years of age, most of our milk teeth have fallen and all our permanent teeth have come out. But for the third molar or wisdom tooth, which typically erupts when you are 70 to 20 years of age. So the period between 0 to 6 is called the primary dentition. 6 to 12 is called mixed dentition. The reason it's called mixed dentition is because we have both milk teeth as well as permanent teeth. Few are milk teeth, few are permanent teeth. After 12, we are into adult dentition or the permanent dentition. So to answer this question, if I have my tooth falling off after 20 years time, will I have a new teeth coming? Sometimes what happens, the milk teeth doesn't fall. The reason is either the permanent teeth can be missing, or the permanent teeth will be erupting at a different place, or it is stuck because of a bad angulation inside our bone. If this happens so, that whether the permanent teeth gets stuck inside or it's at a bad angulation or if it's missing, then what happens is, because the permanent teeth is not coming out at the right time, at the right place, the milk teeth doesn't shake and fall. So it continues to stay beyond our 12th year of age. But milk teeth roots are typically very small. They are almost 1/3 the size of a permanent teeth root. And because they are very small, most often what happens, they don't have strength to withstand the forces of chewing in our adult life. So eventually over a period of many years, as we continue to use the milk teeth beyond its time of function, they start shaking and they start falling. And when it falls, whatever the age might be, when you take an X-ray, we will know whether the permanent teeth is inside or not. If the permanent teeth is inside, we need to take a call whether when we put braces, can we bring the permanent teeth out, or it is beyond us bringing the tooth out, it needs to be taken out and an artificial replacement needs to be done. So this is what that needs to be done. Because apart from these 20 milk teeth and 32 permanent teeth, we don't have any extra teeth coming out. Of course, very rarely, there can be less number of permanent teeth or little more permanent teeth, which is a rarity. It's called supernumerary teeth or congenitally missing tooth when there are less teeth. Supernumerary teeth when there are little more teeth, but it's a rarity, it's not common. But what we need to understand is sometimes what happens when our first permanent molar erupts when we are 6 years of age. Many times we have seen, because during the mixed dentition period, as we grow as a child and as an adolescent, our oral hygiene measures are very poor, they are not good. So we end up having decay on our permanent first molar, which typically erupts when you are 6 years of age. So by the time we get into an adult life, these permanent molars are damaged beyond repair. Typically what happens when they are decayed so much, only the crown portion can fall off because of the decay. And when the crown portion falls off because of the decay, the surrounding root will also be infected, and because of the root infection, the gums will get infected and the gums will get closed. So even though it looks as if we have lost our tooth, the fact remains that we have only lost the crown portion of the tooth. The root is still stuck inside the bone. So this can only be seen when you take an X-ray and see whether we have a decayed tooth and a decayed root, which is causing an inflammation of our gums and subsequently an infection in the bone. When such is the case, where we need to remove the root and then We are not going to have any new teeth coming out there. We need to do an artificial tooth replacement. I hope this answers this question. If there are any other questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
Subscribe பண்ணுங்க, bell icon click பண்ணுங்க. இந்த மாதிரி videos உங்களுக்கு வரும். Thank you.